Hello friends, today we are going to discuss what do you want to know about Parkinson's disease. Your Parkinson's does not define you, your strength and courage does. I am Dr. Jagajit Singh Virk, MBBS, FCGP, FAMS, PGDGM. What is Parkinson's disease? It's a brain disorder that leads to shaking, stiffness, and difficulty with walking, balance, and coordination. All these difficulties are in that person. What organs does Parkinson's disease affect? Parkinson's disease, PD, is a degenerative, progressive disorder that affects the nerve cells in deep parts of the brain called the basal ganglia and the substantia nigra of the brain, midbrain. Nerve cells in the substantia nigra produce the neurotransmitter dopamine and are responsible for relaying messages that plan and control the body movements. What are the signs and symptoms? Parkinson's signs and symptoms may include tremor or shaking, slowed movements, that is bradykinesia, rigid muscles, clog-like rigidity, impaired posture and balance, loss of automatic movements, speech changes, slurring, stuttering, and mumbling, writing changes when your handwriting becomes smaller and smaller. Can this be cured? There is currently no cure for Parkinson's disease. Relieve the symptom and maintain your quality of life only. Supportive therapies can be given, such as physiotherapy and medications. Otherwise, there is no cure for it. What are the early signs? 10 early signs of Parkinson's disease are tremors. Have you noticed a slight shaking or tremor in your finger, thumb, and or hand or chin? These tremors are called pill rolling movements. Small handwriting. Has your handwriting gotten much smaller than it was in the past? Loss of smell, trouble sleeping, sleep problems such as periodic limb movements disorder, rapid eye movements, behavior disorders, and restless leg syndrome, trouble moving or walking. Constipation is very, very important. Masked face, dizziness, or fainting in that patient. What age does Parkinson's usually start? Although most people with Parkinson's first develop the disease at about age 60, about 5 to 10% of people with Parkinson's have early onset disease, which begins before the age of 50. Who is at risk of Parkinson's disease? The biggest risk factor for developing Parkinson's is advancing age. The average age of onset is 60 years. Gender, men are more likely to develop Parkinson's disease than women. How long can you have Parkinson's without knowing? It is possible for non-motor symptoms to start occurring up to a decade before any motor symptoms emerge. Years can pass before symptoms are obvious enough to make a person to go to the doctor. It may have started at the age of even 30 to 40 years. Can Parkinson's disease be cured if caught early? Treatment options for each stage. There is no cure for Parkinson's disease, but medications can help manage the symptoms. In some cases, surgery may be necessary. Lifestyle changes can also help, especially in the earlier stages. These modern times, Stem cell therapy is giving us the fantastic results. Does Parkinson's affect speech? Voice and speech difficulties are common problems in people with Parkinson's disease, especially as the disease worsens. These problems affect your ability to communicate in the work setting and with family and friends, which affects the quality of your life. At what stage of Parkinson's dementia start? Time from onset of Parkinson's to developing dementia is about 10 years. Impairment of mental cognitive impairment. Movements are also impaired. There is a shuffling gait, problems with balancing and falling. What does masked face mean? Some people with Parkinson's disease may experience hypomimia, which is known as facial masking or masked face. Hypomimia affects facial expression, making it difficult to express emotions or use the facial muscles as normal. Basic facial movements such as raising an eyebrow or smiling may be difficult. How should you sleep with Parkinson's? Sleep hygiene tips for Parkinson's disease sufferers include sticking to regular bedtimes, following a consistent bedtime routine with soothing activities such as listening to music or reading a calming book, getting regular exercise, preferably early in the day. Does smoking help Parkinson's? People who had smoked in the past and quit were 22% less likely to develop Parkinson's than people who had never smoked. People who smoked for 40 or more years were 46% less likely to develop Parkinson's disease than people who never smoked. What are the 5 associated speech problems with Parkinson's? Speech problem. People with Parkinson's might slur words, mumble or trail off at the end of a sentence. Most people talk slowly, but some speak rapidly, even stuttering and stammering. Parkinson's motor symptoms such as decreased facial expression, slowness, and stooped posture may add to speech problems. What vitamins are good for Parkinson's? These vitamins include vitamin B12, vitamin C, vitamin D, vitamin E, and folate. Which foods are good for Parkinson's? While there is no prescription for a Parkinson's disease specific diet, to maintain overall good health, most people living with Parkinson's disease should eat a variety of whole millet grains, vegetables, fruits, and protein-rich foods such as meat and beans, seeds, dry fruit, etc. Can you reverse Parkinson's disease? Parkinson's disease can't be cured, but medications can help control your symptoms, often dramatically. In some more advanced cases, surgery may be advised. Your doctor may also recommend lifestyle changes, especially ongoing aerobic exercise. Helpful supplements: magnesium, zinc, turmeric, CoQ10, blueberries, green tea, 5-hydroxytryptamine, and calcium. Exercise: walking, tai chi, massage therapy, movement therapy, yoga therapy, and acupuncture therapy are helpful in this disease in the early stages. Thank you very much.